applause for them. Question number 2. Leonine facies is characteristic of thalassemia major, leprosy, Sjogren syndrome, psoriasis. Very good. Congratulations. Question number 3 goes to Team C. Bronze skin pigmentation is seen in Addison disease, Marfan syndrome, scleroderma, polymyositis. Congratulations. It's a correct answer. Team D. Swan neck deformity is seen in psoriatic arthritis, osteoarthritis, rheumatoid arthritis, or gouty arthritis. Very good. It's a correct answer. Team E. Dance sign is a characteristic of gastroesophageal reflux disease, intussusception, volvulus, or diverticulosis.
No negative marking.
It's a wrong answer. I'm sorry.
Audience?
Anyone from the audience? Yes.
Right answer.
Very good. It's a right answer. Can we have a applause for the audience? Anyone else? Okay.
Now question for the audience.
Sjogren patch is characteristic of psoriasis, pemphigus, mycosis, or tuberous sclerosis. Very good. किसने बोला?
ग्रुप में मत बोलो, कॉमन 5-6 रख लो, वही दे देना.
Can we have a chocolates? Now we move on to the second round.
Now we move on for the second round. It would start from the team E. First question will go to team E. Okay. The rules are this round is transferable. Okay. There is no negative marking, but you have to answer within the first 30 seconds. If transfers to the next, they have to answer within the next 15 seconds. Okay. If they can't answer also, the first answer would be considered final. Okay. Transfers. The full direct answer would fetch 10 marks, and the passable answer would fetch 5 marks for the correct answer. Clear? Okay.
Okay, I would request the audience, please don't prompt or anything. And we'll start with Team E first.
Team E ready?
Okay, the rules are it has got 10 marks. It is a transferable round. And when the question is transferred, you will get half marks of the 10 marks. And you will get 30 seconds, the parent team. And when it is passed on, you will only get 15 seconds. Okay, so let's begin. Question 1. So what is this logo stands for? Team E. Very good. Team D. Next question. It transfers to the next team, team C. Wrong. Water availability, wrong. It goes to the next team.
Specific
Anything?
or specific?
I think we should pass it on, pass it to next team. Next team. I don't.
So 5 marks to team A. This is the eyes on diabetes, which was
This logo is Eyes on Diabetes.
okay, not exactly diabetes retinopathy. It is for diabetes awareness. It is a logo for the World Diabetes Day. Next question to team C.
Can you again,
Sorry, wrong. Pass to the next team B.
team B?
15
Wrong. Team A?
You have to be specific. Any further answer?
Half.
Next,
Next.
team A. Team B. So 5 marks to team A. It is the
National Organ and Tissue Transplantation Organization.
logo of the
NOTO.
NOTO. Okay. 5 marks to team A. डायबिटीज नहीं है, वो पूरा आयन डायबिटीज बोलना था. You have to don't argue first question. First, I am saying please don't argue.
Okay. So we move on to the next question.
Full form. 10 marks to team.
Team B, 10 marks. It's a correct answer. We move on to the fifth question.
Fifth question for team A.
Team A. Very good. Correct answer.
आयुष्मान भारत और प्रधानमंत्री जन आरोग्य योजना. ठीक है. Now question for the audience. Please say the marks at the end of.
Can we have a big round of applause for the teams? Yes, now we go for the question for the audience.
ठीक है.
Meanwhile, they are calculating their scores. We can have the audience question.
Audience question. Identify the logo. Correct. Well, बाद में जाएगा चॉकलेट. अच्छा है. Next question. What does logo signify?
Anyone? Please raise your hand.
Anyone? So this is the logo of the primary healthcare first, which was first adopted during the Alma-Ata conference. So this is the during the 1978. This is the first logo, primary health care.
So we are ready for the scores after round 2.
The team A is got the maximum marks, 30 marks. And rest all other teams have the total marks is 10. सर इनको 5 नंबर दे दीजिए. इनका ओ अच्छा ये सर सॉरी ये वो पेन okay. After the round 2 the team A is on top position. After that is team B who have the 20 marks and rest other have the 10 marks.
Please be seated faster. No prompting from the audience. Okay. So moving on to the next question for team B. Identify this famous doctor public health couple. Both are doctors. Q. Okay. They are the pioneers of maternal and child health among the tribal communities in Gadchiroli, Maharashtra. They run an NGO in the name of Search and awarded Padma Shri in the year 2018. Even if you give the surname, you will get only one name also you will be getting marks. No negative marking, you can attempt. Anyone from the teams?
Or audience?
Audience? Very good.
Chocolate for the
भाई ये chocolate अच्छा है. Now direct question to team C. Ready? Identify this famous personality. Q. Okay. Doctor whose name is synonymous with oral rehydration therapy due to his immense contribution in developing this life-saving solution. ORT or ORS, whatever you say. Saurabh, time. Ramakant Mishra, no, he is a cardiologist. Raman Panda, at least. Any other teams can answer? Audience? Mobile se nahi dekh raha na? So he is Dr. Dilip Mahalamaris, who has worked extensively in the West Bengal and Bangladesh region, saving millions, saving most of the lives due to the ORS.
expired recently, sir. Expired
Yeah, 2 years back. So now question to team D. Ready? Identify this personality. Q. Okay. Eminent Indian pediatrician and worked as the WHO chief scientist till recently, known for her immense contribution in TB and HIV in India. She is Dr. Soumya Swaminathan, now working as in the think tank of the Indian Health Services. So, 0 marks to team D. So, now direct question to team E. Ready? Identify this famous personality. Q. He is a famous Indian doctor and politician in whose memory we celebrate the National Doctors' Day. Anyone from audience? Right, sir. Dr. B.C. Roy or Dr. Bidhan Chandra Roy. He was also the Chief Minister of West Bengal. So, please, Prakash, please, scores at the end of round 3.
At the end of round 3, Team A is leading with the score of 30 marks, Team B has 20 marks, and Team C, D, and E all have 10 marks.
So, now the audience question. Identify this famous Indian woman personality. Huh? Yeah. जोर से. Dr. Anandi Gopal Joshi. She is the first female doctor of India trained in Western medicine. 2 doctors, Dr. Anandi Gopal Joshi and Dr. Kadambini Bose Ganguly, are the 2 first female pioneer doctors in Western medicine from India. Now, next audience question. Identify these personalities. They are the winners of Nobel Prize in 2023 for discoveries concerning nucleoside-based modifications and their implementation in mRNA COVID vaccines. हाँ? क्या जोर से? Anyone from the audience? नहीं क्या बोल रहे थे वैसे? नहीं ये लास्ट नोबेल प्राइज है 24 का नहीं आया अभी तक. So they are Kathleen Carrico and Drew Weissman, both from USA. Okay, awarded Nobel Prize in 2023. So next audience question. Identify this famous personality. He has worked. Wrong. The correct answer is already been given by sir. He is Dr. Ronald Ross, a British doctor who carried most of his work in India and was awarded Nobel Prize for his work on transmission of malaria and isolation of Plasmodium vivax, and he got the Nobel Prize in 1902. Okay. Now we move to the round 4, which is a basically current affairs round. Now I hand over the mic to Dr. Raman.
Good morning, everyone. So I will be taking you through the next 2 rounds. I think numbers so baras rahe, so we need some breaks and more gears to decide our winner for today. So taking to you next round. So our next round is
We to start from
Team E.
Team E.
So next we have rules for the. So this is a current affairs round, non-transferable, and 10 marks for the right answer. No negative marking. So Team E, your question is, the recent outbreak of acute encephalitis syndrome in children in Gujarat was caused by which virus? A. Hantavirus, B. Chandipura virus, C. Ebola virus, D. Nipah virus. Your time starts now. Answer is? No negative marking. Answer is? Kindly name the answer. That is the right answer. Big applause for them. So it is named after the place where the cases were first found. Chandipura is a place, is a village name from Maharashtra. 10 marks for Team E. So the question for Team D is, this virus causes a disease that is endemic in Africa, and the World Health Organization has declared a public health emergency of international concern recently for this. So your options to name the virus are A. Nipah virus, B. Mpox virus, C. Ebola virus, D. Hantavirus. That is the right answer. 10 marks to Team D. Team C, your question is, what is the name of the toxin that is found in unripe lychees that was linked to acute hypoglycemic encephalitis in malnourished children of Muzaffarpur, Bihar? A. Toxicodendron radicans glucosidase, B. Methylene cyclopropylglycine, C. Lycheic acid, D. Cyanogenic glycosides. Your time starts now. Kindly name it. That is not the right answer. Anyone from the audience? Sir? That is the right answer. Applause for sir. So, direct question to Team B. In 2023-24, Kerala reported an outbreak of which viral disease that raised concerns due to its potentiality for severe complications? A. Crimean Congo hemorrhagic fever virus, B. Nipah virus, C. Ebola virus, D. H1N1 influenza virus. That is the right answer. 10 marks to Team B. So coming to Team A, your direct question is, the expansion of Ayushman Bharat Pradhan Mantri Jan Arogya Yojana for elderly of all strata is using what age cutoff? A. 60 years, B. 65 years, C. 70 years, D. 75 years. That is not the right answer. So some newspaper readers from the audience. 65 तो उन्होंने दे दिया and we have told that it's not right. Huh? Answer is 70 years. That is the right answer. So 0 marks for Team A. So we have come to the end of 4th round now, and the scores are
At the end of round 4, Team A and B are leading with the score of 30, followed by Team D and E with the score of 20, followed by Team C with the score of 10 marks.
Big applause for all the teams. We have neck-to-neck competition here. And we also have an audience question for this round. So, which COVID-19 variant has recently been a focus of concern due to its increased transmissibility and the potential to resistance to vaccines? A, alpha variant, B, delta variant, C, omicron variant, D, epsilon variant. So, oh, whole audience deserves a chocolate this time. So that is the right answer, omicron variant. Huge applause for the learned audience here. So moving to the next round, and to trying to spice up the things, we have make it a movie round. So medical movies for all the movie lovers. So all the movie lovers, here is a round in which they can score and come ahead. So still a lot of scope in this quiz to change the scores. So this time, this is round 5. So 1, 2, 3, 4, 5. Team A will be starting. Team A से start करेंगे. So to start with Team A, your question is, no negative marking, not transferable. No change of answers is accepted. The theory of everything, Stephen Hawking is diagnosed with which neurological condition? A. Amyotrophic lateral sclerosis. B. Multiple sclerosis. C. Muscular dystrophy. D. Cerebral palsy. Your time starts now. Please, no prompting.
From the audience, be quiet.
That is not the right answer. So we have some movie lovers in the audience. That is the right answer, A. Amyotrophic lateral sclerosis. Theory of everything. So movie to watch for Team A. So coming to Team B, your question is, a beautiful mind, which mental health is portrayed through the life of mathematician John Nash? A. Depression. B. Bipolar disorder. C. Schizophrenia. D. Anxiety disorder. That is the right answer. 10 marks for Team B. So coming to question for Team C. In Pa, Oro suffers from which rare genetic condition? A. Alzheimer's disease. B. Progeria. C. Down syndrome. D. Cystic fibrosis. That is the right answer. 10 marks for Team C. Coming to Team D, your question is, in My Name is Khan movie, the main character Rizwan Khan has which condition that affects his social interactions? A. Schizophrenia. B. Autism spectrum disorder. C. Bipolar. D. Post-traumatic stress disorder. That is the right answer. 10 marks for Team D. Coming to question for Team E. In the movie The Fault in Our Stars, which medical condition does the main character Hazel Grace Lancaster struggle with? A. Diabetes. B. Cystic fibrosis. C. Cancer. D. Asthma. That is not the right answer. Computer ji, give 0 marks to Team E. So we have some answers from audience. Cystic fibrosis, that's the right answer. So we have come to the end of 5 rounds and the score is, computer ji, score final करके round 5 के end पे बताइए where the teams stand.
At the end of round 5, Team B is leading with 40 marks, followed by Team A and Team D with 30 marks, followed by Team C and E with 20 marks.
So there is neck-to-neck competition still going on, though there is some change in positions. So still there is lot of scope as the last round is rapid fire, where there are lot of numbers to score. So before going there, We have audience question for this also. In the film Tare Zameen Par, dyslexia. So that's why we kept this as the audience question. So what type of cancer Irfan Khan was diagnosed with in 2018, to which he succumbed later? Answer is neuroendocrine tumor. That is the right answer. So now handing over mic to Soumya sir for rapid fire round. Sir, here.
अच्छा ठीक आप उसको ये कर राइट रॉन्ग ना बोलो ना it can be either right or wrong, but if you say pass, you can come over to the next question if you are within the stipulated 1 minute time. Okay? No negative marking. Each question carries 5 marks. So here you have a 40 mark window to play with. Okay? So let's start. Team E. So coming to the rapid fire round. Team E. So these are the rules. Each set carries 8 questions. Each question carries 5 marks. Total time 60 seconds, 1 minute. First response is considered final. If you have to pass, you have to say that instantaneously so that we can move to the next question. Unless and until you give an answer or pass, I won't be moving. Okay. The options are either you have to say the answer or say pass. If you say pass, I will be moving to the next question. Okay. So ready, team E. Expand RBSK. Right. When is World Patient Safety Day celebrated? What was the theme of World Mental Health for 2024? Where is National Institute of Immunology located? A patient has unilateral facial drop, difficulty closing one eye, and loss of taste in the anterior 2/3 of tongue. Which cranial nerve is most likely affected? Correct. Macrolides target ribosomal 50S subunit. True or false? Correct. The cobblestone appearance of the intestine. Please come again. Crohn's disease. Correct. Please let me answer ask the question, then what is the antidote for iron toxicity? Desperance. So, wrong. World Patient Safety Day. So, good performance by Team E.
5 right answers.
They gave 5 right answers to 25 marks to Team E. So, this is a great level around. Try to do your best in this, okay? So, Team D, ready? Team D, here are your questions. Expand MAA. Correct. When is National Nutrition Week celebrated? Correct. What is the theme of World Cancer Day 2024? जोर से बोलना, ठीक है? हाँ. A 35-year-old man presents with weakness of wrist extension and wrist drop. Which nerve is the most likely injured? Correct. Aminoglycosides are primarily concentrated dependent or time dependent antibiotics interaction. Where is National Institute of Virology located? Correct. The stipple sign on a lateral neck X-ray is indicative of which condition? Right. Which antidote used for acetaminophen or correct. You missed the questions. Theme of World Cancer Day 2024. Wrong. One question. Time's up.
6 right answers, 30 marks.
Very good performance by Team D. Team C, ready? So, here are the questions for Team C. Expand ABDM. When is breastfeeding week observed? What is the theme of World Rabies Day 2024? Where is National Institute of Occupational Health located? A patient with carpal tunnel syndrome presents with weakness in the thenar muscles. Which nerve is most affected? Correct. Domperidone is a D1 receptor agonist. True or false? Correct. Great ulnar sign is seen in which medical condition? What is the antidote of lead poisoning? Incorrect. Wrong. 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 So ABDM is Ayushman Bharat Digital Mission, August 1st week, breaking rabies boundaries, which is incidentally today, September 28, the World Rabies Day. Ahmedabad, NIOH, median nerve, false, acute pancreatitis, great ulnar sign, and the antidote is DMSA. Okay. Now moving on to
2 right answers, 10 marks for Team C.
we can have more claps. So now direct the question is for Team B. Ready? Expand INEP. When is World TB Day celebrated? What was the theme of World Health Day 2024? Where is National Institute of Epidemiology located? Wrong. A 50-year-old woman reports difficulty in elevating her shoulder. On examination, she has weakness in the trapezius muscle. Which nerve is likely involved? Wrong. Quinolones act by inhibiting RNA synthesis. True or false? Right answer. Homan sign is a feature of which medical condition? Correct. What is the antidote of benzodiazepine overdose? Correct. I will imagine. Your answer, expand INEP, World TB Day, theme of Wrong. Wrong. Time's up. So INEP is Intensified National Iron Plus Initiative. March 24 is TB Day. The theme of World Health Day 2024 is My Health, My Right. National Institute of Epidemiology, Chennai. The nerve is accessory. Quinolones act by inhibiting RNA synthesis, falls by DNA synthesis, homocysteine DVT, benzodiazepine overdose, IV flumazenil. So, बता दिया आपने?
15 marks.
So now direct questions to team A. Ready? Expand, Suman. World Hepatitis Day is observed on. What is the theme of Patient Safety Week 2024? Where is National Institute of Nutrition? Correct. Which nerve is primarily responsible for the sensory innervation of the posterior one-third of the lung? Correct. Carbapenem's mechanism of action is inhibiting cell wall synthesis. True or false? Correct. Auspicine is seen in antidote for opioid overdose. Correct. Correct. ऊपर 3 का we give it to you. And next, fast and 2 questions.
Now it's time for a score. The team A and team D is on first position. Then team B, who will have got the 55 marks, followed by the team E, who have the 45 marks, and at last the team C, who have the 30 marks. So now this is a tie for team A and B. टीम ए और डी सामने आ जाओ. हाँ बस. This one is working.
Hello, yes. So we have 4 questions for tiebreaker. tiebreaker will be conducted in 2 plus 1 plus 1. So 2 questions in first go. If we have tie at that end, we will have add on 1 question. Again tie, we will have 1 add on question. This is how we have made this tiebreaker. So rules are simple. To begin with, we have team A and D here for this tiebreaker round for the winner position. So we will start with team A for the first question. If they answer rightly within the 30-second frame, they will get 10 marks. If it is passed to the next team, they correctly answer it within the next 15 seconds, they will get 5 marks. And the second question will be started with team D, and similarly 30 seconds, 10 marks, and not answered well, going to you. In next 15 seconds, you are getting 5 marks. So best of luck for this tiebreaker.
अभी आंसर्स ये था
अच्छा नेट पे सर्च करके
हाँ नेट पे सर्च
सो आगे चलिए आप
नहीं आप
team A. So your question for the tiebreaker team A is identify this logo. No negative marking. Wrong. Team D. That is the right answer. 5 marks for team D. Team D. Your question is, a child presents with failure to thrive, eczema and recurrent infections. What condition should be primarily suspected? Options are A. Cystic fibrosis, B. Severe combined immunodeficiency, that is SCID, C. Digeorge syndrome, D. Celiac disease. That is not the right answer. That is the right answer. 5 marks for team A. Again, we have a tie here. So, going to the next question. So, now these are non-transferable. And the one who answers will be declared the winner. तो दोनों क्वेश्चन करते हैं बट नॉन ट्रांसफरेबल. So both teams can answer. They can raise their hand. So whoever answers will get the winner position here. हाँ. So we have a tough tie here, requiring third tiebreaker question. So the question is, what is the main characteristic of borderline personality disorder? Options are A. Excessive need for approval, B. Emotional instability, C. Grandiosity, D. Fear of abandonment. That is not the right answer. Team D, if you answer it correctly, you will be the winner today. Your time starts now, 15 seconds. No, even that is not the right answer. So, answer is emotional instability. That is the main characteristic. So, moving to the last tiebreaker question. So, the one who answers wrongly will get -5, hence will make our job easier, I think. So, now they will have to decide even more firmly about their capacity to answer even. So, दोनों आंसर नहीं देते हैं. Oh, please don't give them more options, sir. It's already a tough condition for us. So, coming to the fourth tiebreaker question. In Something the Lord Made, groundbreaking surgical procedure was developed by Alfred Ballarok and Vivian Thomas together for which condition? A. Tetralogy of Fallot, B. Atrial septal defect, C. Ventriculoseptal defect. D. Patent ductus arteriosus. That is not the right answer. That is the right answer. So we have our winner for today. Congratulations. It was a tough tie. And I want to congratulate Team A also because they did a wonderful job and gave a tough competition to Team D. And I also congratulate the other participants who make it through to this final round. We know we had 16 teams participants, 16 teams participating for the, actually 18 teams participating for the preliminary rounds. So these were the final 5 teams who had us here today for the last 1 hour. Mind-boggling questions and their answers who even made us our job difficult to judge the final round. And I'm so proud to have you people here in our final 5. Thank you.
विनर डिक्लेयर कर दीजिए फर्स्ट सेकंड थर्ड
पेपर है ना
हाँ
नेम्स के साथ
आपने
लिस्टिंग
दिया था
इस पे बोलो और उनको स्कोर बोलने दीजिए
एक बार स्कोर बोल लीजिए फर्स्ट सेकंड थर्ड बता देना
Okay, the team D is the winner with 70 marks. And the runner-up is team A, who got the 60 marks. And the third position is with team B. Thank you to all the participants. D. D, A and B.
call them on stage we have prizes ready here what is the sir आप डिक्लेयर कर दीजिए विद नेम्स उधर बुलाना है
बुलाना है क्या करना है
उनके
हाँ बुला
इस-
दीजिए
जब कैश प्राइजेस आएंगे
फर्स्ट
तो
थर्ड को बुला लेते हैं थर्ड कौन है मैम
सर ये लिख दिया मैंने ये थर्ड है ये मैंने लिखा हुआ है
थैंक्स कर देते हैं
हाँ जी
हाँ
So everyone has enjoyed. I think the rounds were very exciting, very interesting, and tiebreaker में भी हमें तीसरे चौथे राउंड में जाके हुआ. So you can see the competition was very tough and rounds were very interesting. So I would like to take this opportunity to thank our quiz masters. So, and other team members. So, Dr. Anupinder, आप इनके लिए तालियां बजाइए थोड़े से. Dr. Anupinder, Dr. Ramandeep from Pediatrics, Dr. Soumya Sahu from Community Medicine, and our 2 SRs, Dr. Saurabh and Dr. Prakash. So, please give a big round of applause for them also. And now we will announce the winners. And I'm thankful to the organizer.
Thank you, Dr. Kakkad and his team. I think this is first time in history of Bathinda that Dr. Kakkad and his team has organized such a beautiful and intelligent, academically oriented quiz. And most importantly, there was a tie break. So finals का मजा तभी आता है जब ऐसे ही आसानी से नहीं जीतता कोई. So I must congratulate every one of you, and we will, from the organizing committee, we will request you to be present tomorrow for felicitation program from 11:30 onwards to receive your appreciation certificates. So it is great to have a faculty, such faculty to promote academics, because we have encountered a few faculty who are against academics, but we really appreciate your presence. And now I'll request Dr. Vinder Singh, who is amongst us, to come on stage, and no better person than him to give away the prizes. Dr. Sonia Arora, please. And my friend, Dr. K.K. Goyal, to please come on stage to give prizes, because he was supposed to be the genius of our batch. And I am really thankful that he has come all the way from Sarsa to attend the conference. And that shows कि अभी इसका एकेडमिक कम नहीं हुआ है, इवन एट द एज ऑफ कितने साल का हो गया. सो प्लीज आप टीम के साथ ही आ जाइए जी. आके आओ. टीम के नाल आ जाओ जी सारे. कक्कड़ साहब आप साथ में, आपके बिना कुछ नहीं होने वाला. So Dr. Vinder Singh is a great scientist from ICMR, and this year he have got appreciation from the government as well as scientific community for research purposes. So I think Dr. Ashu nahi aaye ji. So Dr. Ashu is also here. She is also from ICMR, and I'll request all the students who can spare their time. एक attendance absent लग जाएगी तो कुछ नहीं होना. But you will not find opportunity to listen to the galaxy of speakers whom we have invited, and they have taken their time out of their busy schedule to address all of you. So those who can spare time, जिनका एग्जाम है वो चले जाओ, बाकी को मैं रिक्वेस्ट करूंगा कि बैठो, एक दिन की अटेंडेंस से कुछ नहीं होने वाला, राइट. एंड पीपल हेयर विल थ्रेटन यू ऑल्सो कि एब्सेंट लग जाएगी, ये हो जाएगा, वो हो जाएगा. प्लीज रजिस्ट, बिकॉज दिस इज ए लाइफ टाइम अपॉर्चुनिटी टू शेक हैंड्स विद साइंट. मैं भी इनसे हाथ में लाता हूं कि यार कुछ ना कुछ अकल इनसे ले लूंगा, वो कंडक्शन होती है ना. सो दैट इज हाउ दीज थिंग्स शुड गो. नाउ आई इनवाइट द विनर्स ऑफ फर्स्ट प्राइज. थर्ड को पहले बुलाना है तो आप बुलाइए. थर्ड प्राइज
Please, Marita and Ansika, please come on the stage.
पीछे पीछे हो जाइए थोड़ा. हाँ, सीटियां भी मारो यार. So you should encourage academics, not discourage academics. नहीं आप करवाओ जी. ग्रेट.
Now, second prize, Ishan and Urvi, please come on the stage.
आओ जी के जी. ना ना एक लिफाफा तुम भी देना यार. नहीं 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 इसको दवाना लिफाफा, एक एक लिफाफा दवाना. So thank you very much. Great performance. Now the first prize.
Now the winners, please come on the stage. Hargul.
Congratulations. वो यार ताड़ियां मारी चलो यार. सवेरे सवेरे हजे तो ब्रेकफास्ट किया होना, एनर्जी पूरी होगी. Great going, and now I invite all the second and third prize also. Please come on stage to have a group photograph. पांचों को बुला लो जी, आ जाओ. Everybody comes over stage. So definitely that shows the attitude of Dr. Kakkad कि इन्होंने बुला के दूसरों को भी इनकरेज करने का काम किया है. प्लीज कम, आगे बैठ जाओ आप बेशक.
बल्कि हम लोग चाहते हैं कि बाकी जो 17 टीम्स ने पार्टिसिपेट किया था उनके लोगों के लिए भी तालियां हैं.
So we will give them appreciation certificates to all the members of the preliminary teams also who have participated in quiz. थैंक यू वेरी मच. ग्रेट गोइंग. आप बोलना चाहते हो कुछ? नहीं नहीं आपने तो सारा कुछ किया यार. फिनिश करो ना यार.
Yes, नहीं कुछ पार्टिसिपेंट्स है बाकी है नहीं A sincere thank you for all those who participated in the quiz, not only the finalists, but also the preliminary round. A total of 18 teams participated, and it was very encouraging to see participation from the 2023 batch also. Okay, and I am glad to say that the only team which participated in the from the 2023 batch, they didn't come last. Okay, the best thing is participation. You will get your, I would say, appreciation with time. So I would encourage everyone to further participate in quizzes in large numbers. There would be 1, 2, or 3 winners, but participation is best. Okay, thank you.
I hope everyone enjoyed this process. That is the most important thing about quizzes. We learn and we love the procedure, the way it is done. And I also want to tell that quizzes are not the highest level of examination which assesses your academic learning. But here we mix things up the way, and the questions are different caliber. You may think that it was easier or difficult for the other one, but it's a little bit of luck and definitely a lot of academic learning which is judged here. So don't be disheartened, anyone who thinks that they know others' questions at the end of quizzes, it happened. So I want to say that all of you did well, and the numbers show there are so many scores. Score sheet is so high scoring match it was, and that tells that you people were doing really well. And we were the quiz masters, but you were the masters of 17 subjects we study in MBBS. So that's a lot of big deal to appear in a quiz that is catering to all the subjects of the field. And I want to congratulate all the participants and the winners of today. And also to the teams who take this stage to the tiebreakers. So we had no questions spared. We had to show all our cards to decide today's winner. And it was really great to go to that extent. Thank you all.